我们很荣幸今天再一次的请到黄医生在我们的来到我们当中，我很高兴认识到黄医生。黄医生真的是一个非常有爱心、专业的医生，他有多年的临床肿瘤科经验，他也是很多临床的试验的项目的。嗯，他是那个investigator 包括那个 Zemata 等等，他被多年选为 top doctors，所以非常高兴，也很荣幸有这么爱心的医生来到我们当中，每一年和姐妹们有一个分享。那我今天就把现在的时间，我们就进入我们的 Q&A Q&A 的问题啊。Dr. Huang, it's very nice to see you again. Are you ready to start the Q&A? OK，好，嗯
Okay, 听到了吗? Can you hear me?
，Yeah，可以的。
Okay. All
好
right. So thank
，Let
you
me
for
share.
inviting me back again. I hope that my prior visits with you have been helpful. And, a lot of times I find that oncologists are very busy and they don't have time to explain things. So I feel like this is a good time for us to sit and talk and spend a little bit more time on the questions that you might have. Of course, um, when I give advice, um, you need to remember that I don't have your entire chart, okay? And whenever I give any advice to any family or friends, I always tell them that the more information I get, the better advice I can give you, because I get 2 sentences on each of these cases, and so very easily what the recommendation I give could be incorrect, okay? Because I don't know the details of your case. I don't know what you have tried before. And, so, if I do say something that's different than what your oncologist has said, maybe you can bring it up with your oncologist, but realize that you have had a long relationship with your oncologist, and and certainly you should listen to them first.
好的，那我大概翻译一下黄医生的，就是黄医生，他不是对每一个姐妹你们的情况了解，所以你们最好还是要征求你们自己的医生的啊、把你们的问题也带到你们的肿瘤科医生那里问他们。所以今天的回答问题，黄医生都是用英文。但是结束之后，如果姐妹们有问题，可以留下来我们尽量的可以再讨论，看有什么问题，大家可以留下来再讨论一下。所以黄医生如果他是用英文讲的，Can we start？
对，对不起，我的中文太差了。OK，
太棒了，我现在才知道你会讲中文，之前都不知道。
okay.
好
The next issue is a time issue. Okay,
，Yeah，
we have 1 hour together and 15 questions. That means we have 4 minutes per question. Okay, so I apologize if I go quickly. Okay. Also, I find that the first few cases are the most difficult, and so um, if we spend more time on them, then we can get through the rest more quickly. Okay.
好的，那我们开始了。
Okay. Do you want to describe each case in Chinese first?
I think it's okay. To save time, just go for it. Just answer the question, I guess.
Do they have they have the questions there? Great. Excellent. Okay. This woman has advanced hormone receptor positive breast cancer with bone metastasis and has been receiving IV Zometa every 3 months for the past 3 years. Is long-term use acceptable? If long-term use may have side effects, should it be switched to other similar medications? Any recommendations? Okay. So first of all, the recommendations I give are for someone with advanced disease. Okay, these recommendations are different than someone who does not have advanced disease. Okay, and so basically for advanced disease, these are people whose cancer has already spread into the bones. Okay, we actually don't know the answer to this as to how long to give it for. There are currently studies being done. We don't know how long to give it for. Basically, if a person has minimal disease, 1 or 2 spots, not too big, then I think that it's reasonable to shorten it. But if they have a lot of disease, we would just continue on a Zometa, forever. Now, no matter what, whenever you're on Zometa, it's very important to take calcium and to see the dentist every 6 months. Okay, so this is question 2. So regarding treatment for advanced estrogen receptor positive breast cancer, after becoming resistant to standard hormonal therapies, is it possible to reuse medications that were previously used? So the answer is yes, you can retry those medications. But in this situation, this is an important time to make sure you have a new biopsy and to make sure that you've had next generation sequencing done, because we have many new drugs that have come about, and maybe you don't have to try the same old drugs and try something new. Also, maybe this is a time to start thinking about chemotherapy, such as the pills, Xeloda, or the newly, very effective TDXD that's recently been shown to be very helpful even for HER2 low positive disease. So maybe think about those things as well. But we try to always use new things. We only save the repeat things for later. And also the longer time you can go in between repeating a drug, the more likely it is to be effective. Okay, so now I'm going to question 3. So 3 years ago, the tumor was weakly positive. The patient has been receiving Zometa every 6 months to prevent bone metastases. Now there is a recurrence in the distant lymph nodes, which is triple negative, and the patient is currently receiving Trodelvy plus Keytruda. The patient also underwent hip replacement surgery last year. And the question is Zometa still necessary? Okay, so because the recurrence is only in the lymph nodes, Zometa is not necessary. Now, if all the disease has been removed, then you could argue that this is still a curative situation. And if it is still a curative situation, then you could consider continuing the Zometa as well. So this is definitely one of those cases where the details matter. Okay, so it looks like you have the cases there. So now we're on number 4. If you could scroll up a little bit. Yeah, great. Okay, perfect. Okay, so I'll give you a moment to read it. Okay, so this is a woman who has, let's see, high-risk disease, and especially high risk because there was a lymph node recurrence during treatment, but it does look like all the disease has now been removed. Completed chemotherapy and surgery. So later took Xeloda. And is wondering what other treatment options are still available. So, Xeloda is a terrific drug. Okay, it's a pill, so very easy to take compared to other therapies, because the problem is this situation is she's triple negative, and so chemotherapy is pretty much the only thing that's going to work. And so if she wants to try something, maybe try a lower dose Xeloda. That's, I guess, or perhaps enrolling in a trial or something. That's my only recommendations. Again, some details may matter. There could be a HER2 low study if she was truly HER2 negative, and then maybe get into the study looking at HER2 for TDXD for adjuvant therapy. Okay, now we're going on to question 5. And it actually looks like we are doing okay for time now. I'm watching the clock carefully. So why don't I pause for a second and see if there's any questions.
黄医生，我 back， I'm back.
Okay.
Sorry， 我们的家里 power out.
Okay. Yeah. Thunderstorm
Yeah.
here. Yeah.
Yeah. Sorry about that.
Well, everybody's been very good about letting me move forward. Does anybody have questions, or do you want to translate anything I said into Chinese that you felt was important? Do you want me to go through 1 through 4 quickly and you translate back into Chinese?
I think it's okay.
Just keep going forward.
Yeah, I think lots of people here are North American, so they understand English should be.
Okay. Okay, so we're on number 5. Okay. So for stage 1 hormone receptor positive disease after lumpectomy without radiation or chemotherapy, the patient had significant side effects from an aromatase inhibitor and had to stop it. Currently doing 1 mammogram and 1 breast MRI each year. Is this sufficient to detect early recurrence? So I would say this is not sufficient. Okay. Is mammogram and MRI. I would say that it's important to take some form of hormonal therapy. She never got radiation, and which is normally given after a lumpectomy. So this is really incomplete therapy. So her risk of a local recurrence is going to be higher because of not receiving at least 5 years of hormonal therapy. So I would recommend that she tries tamoxifen and takes tamoxifen. If she has problems with tamoxifen, even half-dose tamoxifen is going to be more effective than no tamoxifen. It's really very important to be on some form of hormonal therapy. Any questions?
Yeah, Dr. Huang, her question is, if this mammo and MRI is sufficient to
Right.
to find it, to discover, detect.
Right.
Detect, yes.
Right. So the problem is that if she has a recurrence in the breast, okay, then and even if it is discovered, then the treatment will be a mastectomy. because you can't do radiation now, okay, and just another lumpectomy, because they've already removed lymph nodes, so it's probably going to be a mastectomy. Okay, so for that reason, we don't want a local recurrence because the treatment is going to be difficult. Okay, and then the second problem is there's no protection for the rest of the body. Okay, and so she may say, well, I only have stage 1 disease, and it may be low risk. Okay, but I would say that, okay, let's say she does have low risk disease, okay, and maybe she has a 6% chance of recurrence. If she took the tamoxifen for 5 years, then her risk would be reduced down to 3%, in half. Say, well, a 3% difference is very small, but 3% is life and death. And, when you're talking about life and death, it's very, very important to, even small numbers can be very life-threatening. I've had several of my patients, similar kind of situation, refusing to take the medications, and then the cancer came back, and they always regret it. And her risk is going to be higher than 6% because her breast was insufficiently treated.
Yeah, but she didn't do radiation therapy.
That's correct.
Okay. So you suggest try tamoxifen, right? Okay.
That's correct, because the
Thank
problem is there really is no sufficient detection technique, okay? Even if we're able to find a recurrence in the breast, that doesn't detect the rest of the body. Even if you can do a CT scan every 3 months, and a bone scan or, PET scan every 3 months, still by the time it's spread, it's already spread. It's, there's really, the main surveillance is not good enough. Okay, this, you need to do treatment for this. Okay, so let's
one
go on
more
to question
thing.
6. Yeah.
One more thing， 姐妹们，如果你们其实每一条题目都有中文先，如果你们听不明白而需要我们立刻和你们解释的时候，你们可以在 chat 里告诉我们，或者你直接问问题也可以，我们可以停下来回答一下。如果因为有中文的提问，所以你们觉得那一条题目对你们有帮助，或者你们不明白，我们可以停下来回答你们的问题。Some of the people, they say they don't understand English, so just make sure if they have question they can ask. Dr. Wang. Yeah.
I would also say that the first 4 questions were, not, they're very specific for these individuals. So it's not as important. The last 10 questions, 11 questions are more general. Okay. So I'm going to go on to number 6 then.
Yeah.
Okay. So this woman had stage 2 triple positive breast cancer who completed chemotherapy and radiation and has been taking the exemestane. Okay, great. But recently she noticed her walking became unsteady. Okay. Is this related to the medication, or is it likely a result of the chemotherapy? Okay, so my question is, when she says unsteady, does that mean she has numbness and tingling in her feet and can't quite feel her feet? If that's the case, it's from chemotherapy. Okay. But if it's something else, like really unsteady, like doesn't know quite where her hands and feet are, then I'm worried about something else. Go ahead. And is she there? Do you want to ask this question? Yeah.
Yeah, I don't have any tingling on my feet. I don't think it's a neuropathy.
Okay. And how long has this been going on for?
Well, after the chemo finished at 2023 to 2024 and mid 2024. And I just noticed I walk wobbly. It's not very steady.
When did this wobbliness start?
After finish all the treatment. I finished with I'm sorry. Go ahead.
Sorry. No, you said that this unsteadiness has been going on for 2 or 3 years now and
Yeah.
has not worsened and has not improved. Is that
No.
right?
Yes, it's just like remained that way. It's no worsen or yeah.
Okay. So your oncologist knows about this. Is that right?
Yes. And
Okay.
you know, they told me different answer. Well, one told me it's a neuropathy, another say maybe I lost my muscle. So you know, yeah, there are different answers. Some people say my brain maybe got a little damage, whatever.
Yeah.
So
Yeah.
from the chemo.
Yeah. So it is, I would say it's reassuring that things have not changed. Okay.
Mm-hmm.
But if it gets worse, you need to speak to your oncologist. Okay. Because you had HER2 positive disease,
Yes.
and HER2 positive disease spreads easily to the brain. Okay.
Okay, it actually I'm not just have a HER2 positive. Well, I'm done treatment 2024, but 2025 they in the mid June they did a heart CT. They found out I have lung cancer. So that time it's a EGFR lung cancer. So so I had a surgery in the October 2025, but before that they did a brain CT, make sure I don't it's not going to my brain.
Okay. All right. So, lung cancer also spreads to the brain easily. And so you have 2 reasons for cancer to spread to the brain.
Yes.
So if you are having worsening, any kind of nerve problems, you need to let your oncologist know.
Okay. Thank you.
Sure. And the key with recurrence, okay, is persistence or worsening. Okay. So if you're having worsening of your current symptoms, that's something to be worried about. Okay. All right. So we're moving on to question 7. Okay. So she has high risk stage 3 estrogen receptor positive cancer with 11 lymph nodes involved. And she has already, I assume, completed 2 years of the Verzenio. And so taking more, Verzenio is not going to reduce her recurrence risk any further. So we generally only do it for 2 years. Okay. They've not really studied it for longer, so it might be better, but we don't know. It's not been studied. But generally we stop it after 2 years because it's this medicine has side effects. You don't want problems either. So we generally, you could be cured. You've had an excellent treatment, and so there's a good chance you could be cured. Make sure that you take some sort of hormonal therapy for 10 years because you have pretty high risk disease. And also I would probably make sure you're on adjuvant Zometa of some sort. Should letrozole be switched to exemestane? I don't think that it's necessary to switch to a different hormonal therapy. It's been working for you, and so maybe if you switch, that cancer could come back because it's worked so well for so long. Okay, what is the impact of bisphosphonate treatment for osteoporosis on breast cancer bone metastases? Okay, so this is question 8. Okay, if you're receiving a bisphosphonate for breast cancer bone metastases, the bisphosphonate will also help your osteoporosis. Okay. I realize we haven't stopped for questions. Any questions on anything so far up to question 8?
姐妹们有需要问问题吗？你们可以问中文，如果刚才讲的问题不是很清楚，需要黄医生或者我们解释一下吗？
Regarding my question number 7, I also have another question
是
regarding
哪一题是你问的
number 7.
？Number 7
Yeah.
G OK。
Regarding the SERD, how about the new medication of the SERD?
Well, if you are interested in new medications like that, maybe you could go on a research trial, but it's not been proven to change yet. So, it's not proven, and new drugs, you don't know if it's going to cause a problem. So,
Okay.
I would not change unless you're on a study.
Okay, thank you.
So let me give a story, okay? So I've had patients of mine, I've been practicing for a very long time. There was a time when we only had tamoxifen and we didn't have letrozole at that time. And I had patients that wanted to start the new drug, letrozole, as soon as it came out. So we changed them over. And then the cancer recurred when they were on letrozole, the supposedly better drug, okay? So I'm just saying that just because it's better for the average population does not mean it's better for you. So you never want to stop a therapy that's working for you. Okay, any other questions?
还有其他需要问的问题吗？刚才讲的这七题8题。
I have additional question, but how do you know whether the anti-career medication is, most of the cases, when cancer recurs because of resistance. So you don't know until it's recurred. Like, I just wondering, like, any possibility you can know ahead of time, okay, this drug already had resistance on me, then I should change it. Or it's still working on me, I can keep it.
I tell my patients that treating cancer is like treating weeds on your lawn, okay? This is a time that we all are worried about weeds showing up on our lawn in the spring, okay? So what I'm talking about is, let's say the weed is cancer, okay? You had a beautiful lawn and then a weed shows up on your lawn, okay? And let's say, like in your situation, it was a dandelion and it had 11 dandelion balls on it. Okay, so it's a big weed. Now the surgeon has removed the dandelion, it's all gone. And, but it's pretty scary that there's going to be a seed somewhere on your lawn. And so now we've given you chemotherapy, which, is like a chemical weed killer. And we've given you hormonal therapy, which is like a organic weed killer. And, you've been taking all this and you're worried about a weed coming back, because the problem is that weed seeds are too small to see on the lawn. Okay. And so the only way to know if a weed is coming back is only after the weed comes back. I know that's what's so frightening about all of this. Okay. And so that's why it's important to take all the therapies. So if you have, an organic weed killer that works, you need to do it. You need to do the 5 years, okay? Because the problem is we have no way of early detection. The only way to tell if it comes back is when we actually see a weed coming back. Now, if you are interested, there are studies, okay, that are looking at things like circulating tumor DNA and those kinds of things to see. And so if you're interested, you can enroll in studies to look for those new tools, but that does not mean it's better than the standard follow-up. Okay, so I can't say that those kinds of tests are better or not, because that's why we're doing the studies.
有一个问题在
Okay.
chat 里面，他说已经股转了，一直在打 Zmeta 5年多，一开始的时候是4周打一次，打了3年，后来3个月打一次，现在是1年打一次， 是不是1年？现在是半年打一次。那 Zometa 是不是可以一直这样打下去？
Okay, so this sounds like it's like question 1, that it's a late stage disease, okay, that the person already has cancer that's spread. Is that correct?
Yeah, it's bone
Okay,
spread.
yeah. If in that case, we can, we don't know how long to give it for, okay? Some doctors will stop after several years, and many doctors will continue giving it. Okay, I usually continue giving it until they have side effects.
好的。
And they're currently doing studies to see how long to give it for. We don't know. Okay, so we're moving on to question 9. Okay, my doctor uses reclassed 5 milligrams yearly instead of the commonly used 4 milligrams Zometa every 6 months. Is it less effective than Zometa? Can it prevent the cancer spread to bone? Okay, so first of all, reclassed and Zometa are the same medication. It's just made by 2 different companies. Okay, so usually the schedule for this, so you're giving this as early breast cancer prevention, okay? And in that, again, not for late disease, this is for early disease, for breast cancer prevention, okay? And again, this is only given for ladies who have a, medium to high risk of recurrence. Okay, so we don't give this for low risk breast cancer. But for ladies who have medium to high risk disease, the schedules are usually every 6 months. Okay, so we do Zometa every 6 months for 3 years. Another common schedule is Zometa every 3 months for 2 years. Okay, and both of those are the 4 milligram dosage. I don't think that 5 milligrams once a year has really been studied.
Hello, Dr. Huang. So that is also my question, because I consider myself as high risk with 11 positive lymph nodes.
Oh, I see. Yes, definitely. You are high risk.
So
yes.
I was wondering why my doctor just gave me 5 milligram recurrence instead of commonly used Zometa for every 6 months.
Yeah, I'm not sure about that either. I'm not sure. I think that you may want to ask about that. Okay, normally, do you have kidney problems or some other reason? But basically, it's usually given, every 6 months for 3 years.
I see. So at the beginning, he didn't even give me this medication. And last time after I listened to your seminar, so I requested it. And I requested Zometa, but by the time I get to the office to get an injection, I just know it's not Zometa. So that's why.
Yeah, so reclassed and Zometa are the same medication.
I know, but this dose is less,
Yeah, I know. It's not quite
So you think the Zometa 4 milligram every 6 months should be better than?
Yes. I mean, you want to go by what the studies show, right? I mean,
Yes.
Thousands of women have volunteered for these studies, okay? So this is like trying to bake a cake, right? Many people have proven that this is the best recipe, okay? Why change the recipe, especially for something as serious as breast cancer?
Yes.
You don't want the cake to be undercooked or overcooked. You want it just right, okay?
Yes.
So you follow the recipe.
Okay, thank you very much.
Can I ask a question?
Mm-hmm.
Yeah, you mentioned Zometa typically is given to patients who have medium to high risk, right? So how do you define that medium to high risk?
So that is 10% risk or greater of recurrence.
But how do you find that 10%? I guess
Well, your oncologist has access to calculators.
Okay.
Okay. And so if you're not sure, have your oncologist put it into a calculator.
Okay.
And see, and they should. Now, maybe you don't want to hear the number. Okay. Now, some people want to know the number and some people don't want to know the number. Okay. And so, but if it's 10% or greater, then I think it's reasonable to do Zometa. Okay. Another thing that could be done is, I think there's a question later on that's going to look at osteoporosis. Okay. And so if you have osteoporosis, and a lot of Chinese ladies have osteoporosis, then you also would be eligible. Okay. So so even if you have low risk, and you don't mind receiving medications like this, because you're worried about breast cancer, then maybe get that test done.
Okay. So you mentioned this is called recurrence rate?
Yes. So if your risk of recurrence is 10% or greater, then it's usually recommended to take these medications.
Okay. All right. Thank you.
Okay. So we're going on to question 10. These are great questions, by the way. I'm glad
Dr.
we're doing
Wang,
follow-up questions. Yes.
Sorry, Dr. Huang, can I ask a question since we're still talking about Zometa? So, is it true? I was diagnosed of stage 2A triple negative about 2 years ago. Then my recurrence rate, I was told above 25% is quite high because the size of tumor was 2.3 centimeter. I started Zometa about a year after the surgery. Was it too late?
No. So I think when we did this study, it was within a year, as long as you were within a year.
Okay,
So
thank you.
It's still within the window.
All right, thank you very much.
Okay, so I'm going on to question 10. Okay. So for stage 1 hormone-sensitive breast cancer, how can recurrence around year 7 or 8 be prevented? Okay. So, so first of all, this is low-risk disease. Okay, so the chance of recurrence is low. Okay. But it's always on your mind and you're still worried about it. And so, if you had no side effects from the hormones and you really, really wanted to continue taking your letrozole or tamoxifen or something like that, and you really want to keep going to 10 years, and you have no osteoporosis, your bone density is good, then you could argue with your oncologist to keep taking the medication. Okay. But let's say you just want to do 5 years. You finished your 5 years and you're looking for other ways to prevent recurrence. Okay. So this applies for everybody, not just low-risk disease. Okay. So things you can do in your own lifestyle to prevent recurrence include controlling your weight. Okay. Daily exercise, trying to walk a lot, weight-bearing exercise, and avoiding alcohol. Okay. Any questions?
For alcohol, 1 or 2 glass is okay. 有些人很喜欢喝，就1-2杯有可能吗？
Let me pull up the study. Okay. It's not, we're getting more and more data that alcohol is a carcinogen. Okay. And so that includes alcohol. Okay. That includes even small amounts. Give me a second. Let me just, I'm just pulling up the paper. Okay, so in the largest study, okay, about 2,000 breast cancer survivors, they compared people that drank 3 to 4 drinks per week to those who drank, 1 drink a week, less than 1 drink a week. Okay. And they had a 35% chance, 35% higher risk of breast cancer recurrence, and a 50% higher chance of death from breast cancer. Okay. So, I think that you can, if,
Yeah,
it's okay.
也不应该喝酒，也不喜欢喝酒。
少喝一点 okay.
少喝点 yeah.
意思 okay. Just pay, but don't, yeah.
Yep.
Okay, so I'm going on to number 11, okay? So it has been 2 years since a mastectomy on the affected side, but there's still daily swelling and pain near the surgical scar in the armpit area and along the ribs. Is this normal? Okay, so I assume that there is no worsening of pain, okay? That this is the same as it's been since surgery.
That's true.
Correct. Okay.
Yeah, initially, actually, there was no pain for the first 6 months. Then it started pain 6 months later to date. But it hasn't gone worse. It's kind of, persistent.
Have you seen your surgeon?
I saw the surgeon, but she only met me for 2 minutes, and she said it's normal ribs, normal muscle. That's what she said.
Okay. It is common. Okay. Did you get radiation as well?
I did not.
Okay. Well, it is common after the more surgery you have, the more chance for post-mastectomy pain. Okay, I think it's 10 or 15% risk of, persistent pain at the site. Okay, maybe you get in to see the surgeon again. I always tell people that you have to let the doctor have at least 2 swings at the ball. Okay. You can't assume that they will get the right answer the first time you see them, okay? Because the doctor usually thinks about the most common and easily treatable things the first time they see you, okay? So they're not going to think about unusual and difficult things until the second or third time you see them, okay? So go back to see your surgeon again.
Thank you very much.
Okay.
I'll do that.
And if the pain gets worse, then definitely you want to talk to somebody about it. Okay.
Thank you. Thank you.
Have you tried, there is a non-steroidal cream that you can put on, Aleve kinds of medicines that you can put in a cream that you can apply to your breasts?
I haven't, but I will check out.
Yeah. So it's a, go ahead.
Yeah, it's not just along the scar, the scar tissue, where the scar is. It's actually, I have a pain around the ribs too, like rib 4 or 5. I think rib 4 or 5, yeah.
So, I've found because the skin is very thin there, pain creams can be very effective there because it doesn't need to penetrate very far.
All right. I'll go check out. Thank you.
Sorry, I'm just, okay. Okay, question 12. For hormone receptor positive disease who underwent autologous reconstruction surgery, how long should they wait before trying to become pregnant? Okay, we used to be so worried about ladies and things, but it turns out they've done not randomized trials because they can't do that, but they've done studies just looking at ladies who got pregnant soon after, because sometimes it happens. And it turns out that pregnancy does not increase the risk of breast cancer by that much. Okay, so we usually recommend 2 years. Okay, I just want to remind you that means we stop tamoxifen and any kind of ovarian suppression at least 3 months prior to starting to try to get pregnant. Okay, any questions about that?
问这题的姐妹有问题吗？
我想问一下 Dr. Huang, if she get pregnant and then have the baby, after that she can start taking tamoxifen again, right?
Yes, yeah.
Okay, that doesn't have impact to breastfeeding or anything.
That's correct.
Thank you.
And I do want to so the gels that I really like for pain, and so these gels and creams can be also helpful for ladies who have arthritis from the letrozole and medicines like that. Okay, because again, the skin is thin in the fingers, and so oftentimes these creams can really work quite well because they can penetrate into the area. And these medicines don't have any side effects because it's just a cream that you put on your skin. And so it's all over the counter. So one is called Voltaren, Voltaren. And Aleve also makes a arthritis medication as well. And it's called Aleve X.
Can you write on the chat or can you spell it to me so I can?
Yeah, V as in Victor, O L, T as in Thomas, A R E N as in Nancy.
Okay, great. Thank you.
Okay.
The other one is Aleve X, ALEV.
Yeah, Aleve X. Yep.
Okay, ALEVEX, Julie.
Yeah.
Thank you. There's a question in the chat. Maybe can we?
Yeah.
Yeah, let me see. So one or two question on the chat. So 一个就是说我是2期三阴乳癌 triple negative stage 2，经历了新辅助化疗、全切手术，术后服用了6 weeks Zerlida， 化疗期间手脚肌肉脚底肌肉很紧，知觉很差，所以他有那个neuropathy呀，所以他就说现在术后4年了，这个还是没有改进，有什么方法可以帮助吗？
Okay, so the question is about neuropathy.
Neuropathy, yeah.
Yeah. Unfortunately, I don't have a good treatment for that. Okay. Yeah, I don't have any good treatments for it because nerves are the hardest thing to recover from. Okay. It can be a long time before they get better. And a lot of ladies who go through chemotherapy have this as a lingering problem. So time is the only thing, someday they will invent a medicine to improve neuropathy. Okay, but just like they don't have any medicines after a person has a stroke to recover their stroke, except for time, it's the same thing because it's damage to the nerves and we don't know how to make the nerves grow back.
还有 stage 2 stage 3 and 4 HER2. Does she need to take target medicine continuously?
Okay, so that's so the difference between stage 3 and stage 4 is huge, right? Because stage 4 is generally not curable. Okay, whereas stage 3 is curable. So the answer is different.
Karen, Karen, do you want to ask directly?
How about there's 3 more questions here. Let me get through these 3, and then if we have time, we can get some more, okay?
好的。
And maybe you can put it into a chat, okay, so that things can be translated. Okay, anyway. Okay, so question 13. Okay, the ultrasound showed a left-sided nodule increasing from 1.1 centimeters to 1.6 centimeters, but the report still says no significant change. 2 biopsies in 2025 were both inconclusive. Okay, so the first question is, since the nodule grew from 1.1 to 1.6 in less than a year, should surgery be considered? The second question is, could enlargement be related to the biopsy? Can needle biopsy stimulate nodule growth? Okay, so generally, the problem is the difference between a picture and a verbal description of the picture, okay? So, if I have 2 paintings of young women, they can be very, very different from each other. Until you compare the 2 pictures side by side, to verbally describe what you see is very difficult, okay? So let's say you have an oblong mass. Okay, that means, let's say you have a mass that's 1.1 by 1.1 by 1.6. Okay, and even then, so do you describe it by the 1.1 or do you describe it by the 1.6? Okay, so it's very possible that it has not changed at all, just depending on which way they describe it. Okay, so the fact that they say no significant change implies that that's what's going on. Okay, so in most radiology reports, they will talk about which report they compared it to. So if they say we compared this to the 2025 ultrasound and there was no significant change, then I would believe that there's no significant change. Okay. If they don't say that, then it's possible that they really need to compare the picture to the picture. Okay. If it has indeed grown, then you probably need a new biopsy. Okay. Question 14. Okay. So the bone density showed a T-score of minus 2.7, has been taking Nolvadex for 16 months. Should Zometa be started now or just conservative treatment with calcium supplements and exercise? Okay. So the first thing is that I assume that you have low risk breast cancer. Wait, so you have lymph nodes involved, okay, T1N1. Okay, and so you should get a calculation done, okay, as to what your risk is. And if it's over 10%, then maybe you should start Zometa just for breast cancer prevention. Okay, and if you're postmenopausal, then maybe you need to be on letrozole rather than Nolvadex, tamoxifen. Okay, something stronger. So it depends on, how high risk your breast cancer is. Okay. Now let's say you have low risk N1 disease. Okay. T-score of minus 2.7 is right on the borderline. Okay. Some people who don't like to take medications, a reasonable cutoff is if you have 2.5 or greater and you've had a fracture, then we would start the Zometa just for osteoporosis. Or if you have a T-score of -3, then we would also start Zometa early. Okay. You have very reasonable arguments to start the Zometa now, especially, given the lymph nodes involved. Okay.
Hello, Doctor.
Yeah.
Dr. Huang, question 14 is my questions.
Yeah.
Is my risk of recurrence of long distance recurrence the oncotype test shows this 5%.
Only 5%?
Yeah.
That's good. That's wonderful.
5 to 6%. I forgot. Yeah.
Okay, good. That's wonderful.
Yeah.
Good. So then, it depends on whether you want to start Zometa or not. Zometa has side effects. Okay, it can cause teeth problems. You have to get your blood drawn. It can cause a lot of achy joints the first time you get it. And fevers even the first time you get it. It's kind of optional. Okay, so some doctors would start it and some doctors would not.
Okay, so it's not the option. It's optional, not necessary, right?
That's correct.
So when it's necessary for me to start the treatment?
Well, it's if you have a fracture or if your bone density gets worse, okay, then you need to start it. So you've only been on the Nolvadex, the tamoxifen, for a little more than a year. It takes a long time for bones to get better. Okay.
You mean that I take tamoxifen more long time?
Yeah.
A longer time. So
we
increase my bone density.
Yeah.
Okay. For the zoledronic treatment, for the 3 months one time and taking two years, comparing to 6 months one time and taking 3 or 5 years, which one is the effect the same?
Well, they have not been studied side by side. Both are reasonable. They look the same. Okay, 2 different studies. Okay, so we don't really know which is better. Okay. Most of my patients prefer to do it every 6 months because it's fewer visits and fewer needles.
Okay. Every 6 months.
Yep.
Okay. Got it. Thank you, Dr. Huang.
Okay, last question.
Can I ask a question about Zometa? You mentioned about 10% recurrence rate, right? And for those patients, you recommend to have Zometa. So for the 10%, is that by experience, from your experience, or is there a literature? Because my doctor wouldn't prescribe Zometa, to me.
There are models online, okay, that they can type in all the numbers, okay, and get a number out, okay. Or, if you've had an oncotype, then that will get you a number.
Yeah, I guess my question is if I'm high risk, suppose my risk is greater than 10%, but my oncologist still doesn't want to prescribe it. So what I'm wondering is this 10%, is there literature supported, studies supported so that I can show to him?
Definitely.
Okay. Do you have any idea what study?
Well, give me a second. I'll have to type it. I'll have to pull it up.
Thank you.
Let me get to the last question first.
Okay. Thanks.
Okay, bone metastases. This is question 15. Okay. Bone metastases are relatively common in breast cancer. especially for hormone receptor positive disease. Okay. Besides regular image surveillance, which is difficult to obtain in Canada, and just so you know, not proven, okay, are there any early symptoms that patients should watch for? Okay, so so persistent new bone pain, okay? That's what you worry about. Okay, so I'm going to look up this question, okay? If anybody else has questions while I'm doing that, go ahead.
There's 2 more questions in the on the chat.
Okay, I only can take easy, quick questions. I don't want to be here for a long time. Okay.
Yeah, one is related to the gel Carol code. Carol code 是不是手术后可以用这个药膏？
Dr. Huang, I really appreciate that you come to answer our questions, so I want to take a chance. It looks like my question are not on the list. My question is, I have year 2016 with 2A breast cancer, no chemo, no radiation. I took letrozole for 5 years. Then I stopped. After 10 months, the cancer spread. And currently, the main active one is on my pavement area. I just had the radiation for my pavement area.
Okay, hold on. Before we go on, I was still doing the other thing of helping the other woman pull up papers. So how about I will send the citations, okay?
Okay.
Julie, when it's all done, okay?
Okay.
Okay, but, you know, there is an online textbook that most doctors use, okay? It's called Up to Date, okay? It costs about $1,000 a year I think it's maybe up to $1,500 a year, but it's very worth it because it's very up to date. Okay. And also, so that's, but, you know, that's based on studies. I can give you the citations. Okay. Anyway, now your question. Go ahead.
Me? My turn?
I'm ready.
Okay. Yeah. I just had radiation on my pavement area. I developing severe diarrhea, and the doctor said that this is only happen like 2% patient. My diarrhea is uncontrollable. As soon as I eat, I have to run the bathroom. So my question is this a temporary can recover, or this is something I have to deal with longer time?
Okay, I'm sorry. Did the radiation to the breast and armpit or radiation to your liver?
No, not to liver, not to breast. It's to the pavement, my lower body.
Pelvis.
Yeah, pelvis.
Okay. Okay, so this is, it does slowly get better, okay, but it can be very, very long time. Years and years and years and years.
Really?
Okay, yep. So the answer is Imodium.
Yes, I do taking switch back first. One is over the counter, another is prescribed by doctor.
Yeah.
And they are asking for even IV shot. So tomorrow I'm going to get the IV shot to increase the effect for the Imodium.
Yeah. Okay. Yep. It's there are medicines for this, but yes, it is can be a long-term problem. Okay. What else?
Thank you.
Hi, Dr. Huang. Can I ask one more question?
Quick one. Yeah.
Yeah. For neuropathy, could physiotherapy help, or is it safe to use it?
What do you mean by physiotherapy? You mean like physical therapy?
Yeah, physical therapy like that.
Yeah, physical therapy is not going to hurt. I don't know if it's going to help. Okay, we really don't have anything that has been shown to be very helpful. Okay. Medicines like gabapentin or pregabalin, those medicines can make you feel it less, but they don't fix the problem.
Oh, could you please just put down that word?
Those are all both prescription medicines.
Yeah,
okay.
Yeah, I'm trying to get.
So the names. So let me give you a few. Okay. So gabapentin, GABA, P as in pizza, EN, TIN.
Sorry, please hold on for a sec to get the pen. Yeah, first one.
I want to chime in the neuropathy medication. I agree with Dr. Huang. I know those pretty well. We after this call, you can stay. We can chat. I have a neuropathy issue, balance issue, brain white matter damage causing that. It's all like chemo related. Oncologists, they progress me those gabapentin and stuff like that. I agree with Dr. Huang. It doesn't help. PD does not help either. It only takes time. It gets a little bit better, but not fully recovered. So we can chat.
Okay, sounds good. So, then are we going to stay up to Dr. Huang?
Yeah，所以姐妹们如果有问题，我们可以留下来再讨论一下。现在已经蛮晚的了。还有一些问题我们后来再收到的一些问题，这一次没有办法，黄医生都 go over。那希望下一次黄医生有时间，我们可以再过来，他可以再过来和姐妹们分享。非常感谢黄医生。
Julie，稍微等一下，我觉得 Karen 那个问题需要那个黄医生解释一下。Karen，你到底是你到底是哪个情况？你是除了 breast 以外，别的地方有吗
？lymphs， 淋巴 lymphs， 我是 left breast and lymphs， 我得的是 inflammatory breast cancer， 是 stage 3 to 4 HER2。
3 to 4。
HER2.
That's exactly Dr. Huang's question. Is 3 or 4?
3 to 4. The doctor said it's not totally 4 yet, but near 4. So and the doctor.
So you have cancer in your lymph node.
Lymph node it spread to my
可
neck.
是淋巴都已经去掉了，对不对？所以你现在
没有，我没有。I
no
didn't
surgery.
do no surgery option for me. The doctor didn't do any surgery, and she said I need to continue with the target medicine. Even all the numbers is normal, and I cannot stop. So that's why it's very frustrating for me.
You mean spread to neck lymph node?
Yes, the lymphs. First is armpit, then it goes under my, to my neck area and my abdomen area.
Okay, so
that's stage 4. Right?
Yeah, that's stage 4.
Yeah, that's stage 4.
Yeah, and so the doctor said even my CA number is low and there's not much activity on PET scan, but the doctor don't want me to stop the medication. So is this the right way to do it? Continue.
Right. So let's talk about the weed problem again. Okay. So you have such a big weed with so much growth that it cannot surgically be removed. Okay. So in that situation, the only thing we can do is just put chemicals on the lawn. Okay.
Okay. So I have to continue with the treatment.
Yeah. Maybe in the future they'll have some treatment for it, but some way to shrink it down. If it shrinks down enough that a surgeon could remove it, okay, maybe, okay, but you might need multiple opinions. I had a woman in your situation, okay. We went through multiple surgeons. We finally got a surgeon in Hopkins to remove the really, really high up lymph nodes. They were willing to. She had permanent arm swelling. for the rest of her life and was on chemotherapy for a very, very long time. Then she left. I don't know if she had a recurrence or not, but I know that, the surgeons all said we should, those lymph nodes are too difficult to get to. And so that's the problem.
And also, the target medicine affect my heart, the side effect.
Right. So it's not easy. These are difficult situations.
Okay, thank you.
That possible to reduce the dose, Dr. Huang?
Definitely. I mean, if you have stage 4 disease, okay, it's a balance between length of life and quality of life.
Right.
Okay. And so, if more chemotherapy doesn't really make that much difference, so you need to find something you can do for a long time, because it's really how long you can do the therapy, not how much therapy you can get at once.
Okay. It seems after the chemo, everywhere is reduced. It doesn't have the activity at all. But still, the doctor said, okay, it is because the drug suppress it. So I need
the
to
problem is that to be cured of cancer, every cancer cell needs to be dead. Okay. If you have one seed on the lawn someplace, even one cancer cell someplace, then the cancer will grow, can come back. Okay.
Okay, thank you. That's what my doctor told me.
You got a second opinion today.
Yeah.
Okay.
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 Thank
I
you.
hope it
Thank you.
wasn't too depressing. I hope it was helpful for you.
Thank you very much.
黄医生，最后一个他有张照片在 chat 里面，一个药膏手术后可以用吗？叫做 Kelocote Kelocote。
In the chat, right?
Yeah, in the chat. 最后的应该。
And so I don't know what's in this. So I think this is so what is she using this for?
手术后, so it's after operations. Can she use it? That's what she said.
It's
like
silicone. It's a silicone-based, Dr. Huang.
Advanced formula scar gel.
Yeah. So this is not a commonly used medicine. Okay. It might be used to reduce the scar that you get after surgery, but it's not for pain or anything like that. Okay. It's not commonly recommended, but.
OK， 好的，谢谢黄医生。
OK， 好，
谢谢你的时间。那我们下次有机会再请你回来回答其他的问题，还有一些，Yeah， 谢谢你。
好，再见，再见。
谢谢黄医师，
谢谢，
谢谢，
拜拜，
拜拜，拜，Good night，
Good night，谢谢。